That was a really inappropriate response from this oncologist. It is not accepted. We are asking for a second opinion. The key here is ask for a second opinion.
Nobody's going to go through life and never get sick. Everyone's going to die at some point. Everyone's going to need care.
And so we can just push that cost onto the government.
Can't or don't feel comfortable advocating for yourselves, find somebody that will advocate for you.
There's this other aspect, real quick, that I think is interesting to think about, David, is the insurance companies, while what you're saying is true, where it's kind of silly that they're paying for you hopefully to not get sick. And you talked about that 5% versus 95% ratio there, where they're basically responsible for all of it, even though maybe only 5% of your health has to do with your interaction with the healthcare system. But at the same time, it's kind of strange that we even call it insurance, because nobody's going to go through life and never get sick. Everyone's going to die at some point. Everyone's going to need care. So they're also investing in someone that they know they're going to have to pay for later, essentially, unless something, I guess, terrible happens and it's too late for care. You know what I mean? So that's kind of like the other side of this that is almost confusing about why the system is the way it is in the first place.
Yes, let's talk about why the system is the way that it is, right? And so why do we have an insurance setup? And so this all started with, have you ever heard of Blue Cross plans, right? And then they turned into Blue Shield plans, so coverages for in-home visits. So it used to be that a doctor would come and visit you in your home, and that would cost money. And so somebody thought it would be a really good idea to have a insurance product that would cover a physician to come to your home and provide care to you. Fast forward to the Great Depression, when there were freezes in employment, and there were wage freezes, and you couldn't pay employees more money to come and work for your factory to make Ford or GM or whatever product. But what you could do is you could offer them these Blue Cross Blue Shield plans, right? You could offer them insurance. And so that became the driver to get people to come and work for you. And so those manufacturing organizations really held on to that as a tactic to get employees during the Great Depression to increase the manufacturing efforts during the war efforts.
Yeah, I've read through before. It's a pretty interesting history. But Ryan, you said, like insurance, you cover someone, and then with the understanding, like eventually they will need high levels of care. I think realistically, right now, most people age into Medicare. So for the most part, employers provide health insurance, whether that's not for profit or that's a for-profit organization. That's where it comes from. And then the goal is to keep that person healthy enough. And if there are going to be needs down the line, those will happen when that person has aged into Medicare. And so we can just push that cost onto the government, and the government can foot that bill. Now, of course,
True.
We live in a closed system.
It's still
in
the system.
It's a big system, but it's still a closed system. So it does come back, and how Medicare influences pricing, that trickles down into how all the other organizations, how they negotiate contracts. Medicare kind of sets the stage for a lot of that. So there are downstream consequences, but those big expenses, if you can put them off, that's not your problem. And I think this is I think I've heard this called insurance plan stickiness. So insurance plans are not really incentivized to really work with someone to prevent. So let's say, Ryan, you and I, we work with data science, we work with machine learning. I have a very high confidence that I can predict, who's going to come down with diabetes and be diagnosed with diabetes in the next 5 to 10 years. I can probably say who's likely to have a heart attack in the next 5 to 10 years. So some of these big costers, we can predict that. The question comes down to what happens with that information. And realistically, a lot of people change insurance plans every year. They go between different organizations. Their employers will negotiate with different rates between different healthcare organizations. And so if we invest heavily into really preventative medicine, and we heavily reimburse that, and we focus on getting people healthy, there's a lot of those people who are going to go to a different insurance group that maybe is not investing in preventative medicine. And our financial gains will go to someone else. And so conversely, another healthcare organization, if they're focused on putting off expensive care and just pushing that down the line, a lot of those patients are going to go to a different insurance organization, which will have to foot the bill. And so if patients would stay with the same insurance provider for long term, then insurance providers would be heavily investing in the preventative care. But right now, like, insurance companies can only look on a 1 year to 1 year basis because we all have to remain financially viable. Even a not-for-profit, you have to be financially viable or you close the doors. That's just how it works. And so we're in this kind of an awful situation where we know that we need to be investing in proactive care, but we can't do it until everyone else does it. It's sort of like, no one needs a lawyer until someone else has one. Like we all need to invest in it at the same time, or have some type of federal mandate where, this is going to be the case. Or maybe you've got some isolated community where there's one hospital, one insurance provider, and you can actually work on this experiment. But I'm not sure if that place exists.
So look at the experience that you have within Medicare and Medicaid plans and this newer concept of special needs plans. So special needs plans for the chronically ill, dual eligible special needs plans that are tying Medicare and Medicaid together, and the population health and initiatives, the quality initiatives that are happening within those plans. Although it just got sunsetted this year, the value-based insurance design program from CMS came out and was allowing health plans to be really innovative for government-sponsored plans to do healthy eating, transportation, gym memberships, all of these other, supplemental benefits that would not be primary health related, but have an overall impact to a member's life within these segments of the population. And so to your point, I think that's why commercial insurances aren't really doing it, because members will flip, right? And so we're really just trying to put out the fires within a commercial environment. But in a government-sponsored environment where Medicare Advantage plans are able to offer flex spending cards to get your dental, vision, and hearing benefit. If you're a Medicare fee-for-service member, you're paying out of pocket for your dental, vision, and hearing unless you get a supplemental product for it, right? A Medicare Advantage plan is going to offer you that because they know that there is an impact between you having dental, vision, and hearing care and how much we're going to spend at the hospital for you. We know that if you are discharged from the hospital, if we give you 7 days worth of meals delivered to your home post-discharge, you have better outcomes, right? I think you see a lot of innovation within the insurance system is in those government-sponsored plans. And I think that the funding levels have allowed us to do that through things like risk adjustment, right? So being able to focus on risk adjustment funding and value-based contracts to really try to get those populations healthy. And that's where you can really see the decrease in utilization within the system. I think a longitudinal study, I think it was like, in order for a member to become quote unquote profitable, or for you to see a decrease in spending for one patient, you needed to have that patient on your books for at least 3 years.
I think this is interesting, but I think I want to maybe take a slight different direction here. So Rylan and I started this concept, this podcast, with the intent to help individuals feel empowered to get better outcomes so that we can be empowered to take control of our own health rather than be victimized by corporations, by, faceless government entities, any of that. But we want individuals to feel like they can make a difference in their own life. And maybe with the remaining time here, we could focus on some things that people can do. So we've talked about value-based care, really only, delivering things for value. And I can kind of, obviously, we can't, as an individual, I can't just go to, my healthcare provider and say, I need value-based care, because that's not a thing.
You could.
It's not
I could, but it's not going to go anywhere. Yeah. So
They might do it. Yeah.
But I was just going to maybe to start the conversation. About a year ago, I took my daughter in to an urgent care. She was sick. We really weren't sure what to do. We took her in. Physician saw her and said, okay, well, it's most likely a some type of bacterial infection. Could be strep, could be one of the other things. And I proposed that we send a bunch of tests. We do a bunch of cultures. And I said, okay, well, that sounds great. I mean, it'd be great to know, like, specifically which one it is. But then I asked, what would the course of action be for all of these different things? And the physician said, regardless of what it is, we would prescribe antibiotics. So here I was in a situation where a physician was trying to do the best they can, but wanting to figure out what's causing the problem, causing a negative outcome, and was going to order a bunch of tests, which is going to come back and cost me money, cost my insurance money, and they get reimbursed for these. So money flows, but the results of those tests weren't going to affect the treatment plan at all. And so I said, is there any way we can just skip the tests and just skip straight to the antibiotic? And the physician was really confused, but said, yeah, we can do that. And so I think in that case, we were able to do that. And so kind of advocating for myself, understanding a little bit about the system, and just being able to say, well, how does this change things, rather than just blindly accepting what the system wants to do, what the prescribed workflow tells the physician to do. That saved me, several $100s that would have come back to me from that urgent care visit. Probably, unfortunately, it probably would mean the physician gets compensated a little bit less for that visit, but it also saved my insurance. And if, just like little things like that can reduce costs. But what are other things that an individual can do, that, a consumer of the healthcare system, what are things that people can do that would make their outcomes better, make their experiences better?
Yeah, I mean, understand your insurance and understand your insurance product, right? So whether or not you're getting your insurance through your employer or through Medicare, Medicaid, or Marketplace product, understand your insurance. Take the time to read that explanation of coverage, that EOC. So really take a deep dive and understand what are the benefits that are being offered to you. Because a lot of the times there are benefits within your insurance plan itself that can lead to healthy outcomes, right? There are different a lot of insurance companies right now are offering services through like Headspace and Calm and some of these other like app-based things to support your mental health, yoga, meditation, things of that nature. So really understand those nuances within your insurance plan. Secondarily, when you are with your provider, when you are faced with a health challenge, ask the hard questions, right? Sit down and don't accept this as the first, right, best, only answer. I will give you an example here. My wife was recently diagnosed with breast cancer. We went into the hospital. They said, we are going to give you a multi-specialty team. It's going to be a team of a surgeon, a radiation oncologist, and an oncologist, right? And these are your three people that you've been assigned to, and you're going to meet with them all on this one day, and they're going to come in at these times, and you're going to have a discussion with them. The first oncologist that we saw walked into the room, didn't acknowledge us, didn't say his name out loud. He sat down and he said, well, I just got out of the tumor board. You either have stage 1 or stage 3 cancer. We're not really sure what it is. We're going to do a lot more tests. But if it is stage 3, we're going to have to do 8 weeks of chemotherapy before you have surgery. Any questions? Well, yeah, actually, we have a very large amount of questions because you are the first person that we've spoken to since getting a phone call acknowledging that my wife has cancer, right? If we would have just accepted that as the status quo, that this multi-specialty team is the team that I have been assigned, that they are going to be the end-all be-all, that would have been our oncologist today. But since I work in the system, I have a very good understanding of how to advocate for myself and those around me. I said, that person is not coming in to my wife's room ever again, right? And so we were able to get with an oncologist that her mom had a really good experience with. We talked to neighbors and friends, and we got a name of a really great oncologist, and guess what? She was amazing. She's a breast cancer specialist, and she was fantastic. And so being able to advocate and push back because this is your health and you have responsibility in this, it is very important. So advocate.
So I'm curious, how do you actually do that? Do you just tell the hospital, like, we want to see a different oncologist?
Yeah, I mean, so how do you do that? So we had that experience, right? And then we had 2 physicians come in afterwards, and in between, there was a nurse navigator that was assigned to us as a part of that. that was assigned to us as a part of that process. And my wife and I were having conversations in between the physicians coming in and out of the room. And at this point, my wife is crying. And so we said to the nurse navigator, that was a really inappropriate response from this oncologist. It is not accepted. We are asking for a second opinion. The key here is ask for a second opinion for another oncologist, right? And we said that to our nurse navigator. Now the nurse navigator took that and ran with that, and we ended up getting the director of the program coming in and apologizing prophetically, bending over herself to apologize for the experience that we had. Anybody, the nurse navigator, the patient register, at every hospital there's a patient advocate, and there's a patient advocate number. Know what that number is, and feel free to pick up that phone and call that patient advocate number.
That's great advice. But I will say this, it is easier said than done, I think, because I think in your case, I think it was kind of an obvious mistake, if you will, with the bedside manner of that doctor, right? I think David kind of got lucky with his doctor that was willing to not do those lab tests. But most people either don't have the confidence to ask some of these questions, or don't even know what questions to ask at the beginning. To be honest, like, it's kind of difficult to actually evaluate your healthcare professional. If you don't know anything about the endocrine system, how do you know that your doctor's doing a good job or not, for example? But at the end of the day, I agree with what we're saying here, that we need to hopefully have patients and consumers be empowered where they feel like they can kind of work with the doctor as opposed to working with some kind of dictator that's just telling them, hey, you got to get charged here, here, and here. And I would argue that kind of the best approach for it, especially if we want to dumb this down to get rid of all like the technical jargon that can come into it, is just your level of trust with your doctor. Do you feel comfortable bringing something up with them? Do you feel comfortable asking questions? Do you feel like your questions are being answered to the extent that you feel they deserve to be answered? And maybe that's the best metric we can give to people when it comes to evaluating and navigating the system of payers and providers. On the provider side is evaluate how much you trust your provider. If there's room to trust your provider more, maybe consider finding another provider. What do you guys think about that?
So we've trained society. If you see something, say something, right? We all know that. If you see something, say something. We've trained the entire society around safety concerns within airports and other places to say something if you see something, right? It should be the same way in the hospital setting when you're receiving your health care. If you see something, say something. If you feel something, say something. There are people that are within the healthcare system that are truly there to be your advocate and to be your support person. And if at any time when you are receiving care for some of these devastating illnesses, say something.
Because some of these doctors have some big egos. They spend a lot of money to go through medical school. I argue perhaps that maybe that shouldn't cost as much as it does. And that's another aspect to the system that people are overcharged because they know they'll eventually get the money back. And it just is a loophole of the system of expense. But yeah, some doctors are better than others. I don't think that's a secret.
Yeah. I like that. Now we are running low on time. I think it's worth, shifting over to the 1 minute for 1%. So Charles, Absolutely. If you had 1 minute to tell the world one thing to empower them for better health outcomes and better navigation of the system, what would that look like?
I would say, imagine what a healthcare system looks like where every patient feels heard and every provider feels supported and every payer focuses on truly supporting that partnership, all going in the same direction. Achieving this really starts with small changes, and those small changes are starting the conversations like we're having here today. What are the intersections between the responsibilities of us as patients and members of a society, those of the payers and insurance companies that we see, and what are the responsibilities of those providers that we're asking and putting our lives in their hands? As patients, as I've mentioned, advocate for yourself. If you can't or don't feel comfortable advocating for yourselves, find somebody that will advocate for you. Ask the questions, know your coverage, and don't be afraid to ask for a second opinion. Empowerment begins with knowledge. Providers, lead with empathy. Take a moment to connect with your patients, not just their symptoms, but their fear, their goals, and really strive for clear communication, because clear communication saves lives and builds trust between you and your patients. For payers, streamline and simplify. Remember that every denial creates stress and can harm patients. Prioritize collaboration and not bureaucracy. We don't need to overhaul the entire system overnight to see real progress, but incremental change is possible if we all do our part.
I love that you hit on the three heads: providers, payers, and consumers, a holistic approach. Charles, you have amazing background, amazing insight, so thank you for that.